Of all disabilities, intellectual disability is the most appalling because the ones affected are not even aware of their disability. While globally there has been a tremendous advancement in this field, India had been grappling with the issue until just a few decades ago. In 1987, the INDChem Research and Development Laboratory, headed by Mr. N. Kumar, Vice Chairman, the Sanmar Group, embarked on a path-breaking project to bring technology to help children with intellectual challenges. As part of this endeavor, Air Vice Marshal V. Krishnaswamy, an electronics expert, Mrs. Jaya Krishnaswamy, an educationist, and Professor Jayachandran, an internationally renowned developmental psychologist, got together to develop a system of early intervention in mental retardation suitable for the Indian social milieu. This exercise led to the formulation of Upanayan Early Intervention Program in 1989. The word Upanayan means to lead along. It is a systematic, structured program for the management and training of children with developmental delays. In this program, the mother as an educator leads the child along the path of development. In the process, she is advised and guided by experts and evolves as a carry-over agent, co-educator and a co-therapist for her child. As a testimony to its import, Upanayan was blessed and released by Saint Teresa. On 12 December 1989, Madhuram Narayanan Center for Exceptional Children was set up as a resource-cum-demonstration center for the Upanayan program in memory of Mrs. Madhuram Narayanan, whose family has been instrumental in the creation of this project. MNC had its humble beginning at a small but adequate place with 3 children and 4 special educators. Within a couple of years, the strength rose to over 100 children. At MNC, each child is assessed by a multidisciplinary team of experts who devise an individualized education plan unique to the child's needs. This includes physio, occupational, speech and play therapies, yoga, and so on. This holistic intervention program maximizes potential in the children, preparing them for the ultimate goal of inclusion. Soon the work drew the attention of UNICEF, which sponsored MNC to attend the International Portage Conference at Jamaica in 1990. Meanwhile, at the national conference organized by the National Institute for Mental Handicap in India, 2 MNC parents presented the simple and easy way Upanayan was being implemented at MNC. This transformation from helpless parents to empowered changemakers on a national level demonstrated the magnitude and potential of the program. Seeing the progress of their children, parents coming from even far-off places endured immense hardships to bring their children regularly. Leaving all their burdens outside, they would enter enthusiastically, looking forward to working with other parents, following the instructions implicitly. What they initially perceived as a misfortune turned into a blessing, as they felt a powerful sense of purpose in their lives for the first time. Faced with many crises to relocate, MNC was gracefully given a home by the management of Balamandir Kamraj Trust at their premises way back in 1994. Since then, this symbiotic relationship has developed into a long-standing partnership. MNC and Balamandir Research Foundation have been partnering in several programs in parenting across various cities. This enriching partnership led to the integration of MNC with Balamandir Kamaraj Trust from 1st April 2018. The center itself has expanded its services to a much broader spectrum of disabilities that include children with cerebral palsy, autism, Down syndrome, and multiple disabilities, providing them adequate therapeutic intervention along with early intervention. Additionally, music, art, dance, theatre, and physical education have been introduced. Medical intervention for general health, vision, hearing, dental care have also become part of the program. Meanwhile, there has been a gradual awakening among the parents in understanding and caring for their child in terms of education, health, vocational training towards self-management, etc. Support groups, advocacy groups, and government initiatives have also helped the parents understand the rights of their children. Every parent wishes to see their child integrated into mainstream society. But this is not just a dream. It is a reality that is happening. The integration of MNC with Balamandir Kamaraj Trust has paved a roadmap towards inclusion. As part of the Sanmargam project, cognitively developed children are being sent to Balamandir pre-primary and primary school. Annapurna project is a methodology projected to display the outcomes in the nutritional status of children from the given medical interventions. Sambhavam project introduces children to experiential intervention by exposing them to real-life situations that reinforce skills learnt in the school environment. Socially Useful Productive Activity SUPA is a program initiated to train the children who are not suited for mainstreaming to lead a productive life as they enter their adulthood. Over the years, the backbone of our growth has been the special educators, therapists, and supporting staff. The special educators are a rare and precious breed of people who possess infinite patience, compassion, and a calling to serve. These unsung heroes are hard to find. To identify potential candidates and nurture their skills, MNC set up the AVMVK Training Academy. The Academy offers diploma in Early Childhood Special Education approved by Rehabilitation Council of India. MNC also partners with the Government of Tamil Nadu in various projects such as setting up early intervention centers in various districts and providing training for staff under Sarva Shiksha Abhiyan. MNC is committed to research and constant updating of the program. The center has developed Upanita, a software that documents data and analyzes progress of each child in the early intervention program. The software is now in cloud platform which will help in replicating the program. MNC also conducts workshops and international conferences that give access to the latest developments in the field of early intervention globally. While we strive to reach out to as many children as possible, we also constantly remind ourselves that over 70% of these disabilities can be prevented. In this context, MNC has set up a team of special educators, psychologists, and medical professionals to educate parents in planning safe pregnancies and delivery. The spark that started 3 decades ago has now become a guiding light in the field of early intervention. Recognition has come from many quarters, but our greatest reward comes from the smiles of these divine children. These kids are doing just fine. It's we who need inclusion in their pristine, flawless world.